She was sleeping peacefully. The yellow lab hadn't moved from her side in 7 hours. Her parents thought it was love. It was love, but it was also something else entirely. Honey had been part of the Forsyth family for 4 years. She was a yellow Labrador with the square head and the deep amber eyes and the temperament that makes labs the most widely kept breed in America. A combination of warmth and steadiness and the particular quality of being uncomplicated to love. She had been Dara Forsyth's dog before she became Dara Forsyth's child's dog, and the distinction had never mattered much because Honey did not appear to experience people in categories. The baby's name was Rosalind. She was 6 days old, and she was wrapped in a pale pink hospital blanket that had made the trip home from the birthing center like contraband. 6 days old is younger than most people's understanding of newborns. It is the age at which a baby has not yet decided whether the outside world is worth engaging with. When sleeping takes up 22 of every 24 hours, when the entire enterprise of being a person is operating on the narrowest possible margins. Honey lay down beside Rosalind's bassinet on the first evening home and did not get up. She ate when Dara brought her food to that spot. She drank when Dara set her water bowl close. She moved only when she needed to, briefly, and returned immediately. Her nose was pointed toward the bassinet with an orientation that was not random. When Dara shifted the bassinet during the night, Honey adjusted. When Dara moved to the chair to feed Rosalind, Honey moved to the chair. The contact point between them was constant. Dara's mother came on day 3 and said the dog is so sweet, she loves the baby. Dara's husband, Jerome, said she's been like this since we got home. Nobody said anything concerning because nothing concerning was visible. Rosalind slept and ate and was, by every external measure and by the discharge assessment of the birthing center nurse who had visited on day 2, perfectly fine. On day 7, Honey began adding a behavior to her vigil. She began pressing her nose to Rosalind's heel, specifically the left heel, the small soft pad of a newborn's foot, that is, in the first weeks of life where nurses take blood draws. She pressed there and held for several seconds, then lifted her head and looked at Dara, then pressed again. Not aggressively, with the precise, deliberate attention of an animal reading something specific. Dara watched this for a full day before she called the pediatrician. If you stay for stories about what animals sense before we do, you're in the right place. Subscribe so you don't miss the next one. Dr. Naomi Atkins ordered the blood work based on Dara's description. She said it was precautionary. She said newborns at 7 days who are nursing well and meeting developmental markers were almost always fine. She said, bring her in tomorrow morning. The blood work came back the following afternoon. Rosalind had neonatal jaundice with bilirubin levels significantly above the threshold for phototherapy. The levels had been building silently since birth. Jaundice in newborns is caused by an immature liver struggling to process bilirubin, and it is common and it is normally caught by visual inspection of skin yellowing. In babies with darker skin tones, this visual indicator is frequently missed in the first week. Rosalind had Jerome's complexion. The level at which neurological damage from untreated hyperbilirubinemia can begin is not expressed in dramatic symptoms. It is expressed in a number. Rosalind's number was not at that level, but it was heading there. Bilirubin produces a specific chemical signature as it accumulates in body tissue. It is a compound with a distinct scent profile. Dogs have been documented in research settings to identify bilirubin-related compounds at concentrations far below what human perception can register. The heel, the place in a newborn's body where bilirubin concentrates most detectably through skin. The place where Honey had been pressing her nose for 24 hours. Rosalind received phototherapy treatment and her bilirubin levels came down within 48 hours. She came home on day 9. Honey pressed her nose to her heel when she arrived, held it there for a moment, and then step back and lay down nearby in the easy, final way of an animal who has done what it set out to do. Has your dog ever done something that made no sense until it was the only thing that made sense? Tell us in the comments. These stories deserve to be heard. The pediatric hematologist who reviewed the case, Dr. Yusuf Osei, asked Dara during the follow-up appointment whether there had been any unusual behavior from a pet in the home during the first week. He asked this the way a doctor asks a question he has asked before. She told him about honey, about the heel, about 7 days of vigil. He nodded and wrote something in the chart and said, "There is literature on this. It is not as unusual as people think." Every guardian deserves to be recognized, even the ones who never ask for anything in return. If stories like this matter to you, subscribe so you never miss the next one. Dara has a photograph from day 3. Rosalind sleeping in the bassinet, perfect and pink, and Honey lying beside it with her nose pointed toward the baby's heel and her amber eyes open, watching with the steady attention of someone who has taken on a responsibility and intends to see it through. The next story involves a bulldog and a toddler who spent 3 days terrified of each other, and what the vet found that explained the behavior of both of them.